Hello, I'm Dr. Barb Dupree, gynecologist with Lakeshore Health Partners Holland Hospital.
I'm Dr. Susan Kellogg-Spott, Director of Female Sexual Medicine at Academic Urology Center for Pelvic Medicine.
I'm Dr. Michael Critchman from the Southern California Center of Sexual Health and Survivorship Medicine.
In this video, we will discuss the safety and efficacy of Osphena.
SERMs are non-hormonal agents with tissue-specific estrogen agonistic and antagonistic effects. In some tissues, Osphena acts as an antagonist and inhibits estrogen effects. Whereas in other tissues, such as the vagina, it acts as an agonist, mimicking the effects of estrogen.
As clinicians, we see many types of women who have moderate to severe dyspareunia, including postmenopausal women naive to prescription therapy for dyspareunia.
Let's review an example of an appropriate patient for Osphena. Meet Donna. She's 58 years old and 6 years post-menopause. Donna is healthy with no history of cardiovascular disease, breast cancer, or endometrial cancer.
Hello, my name is Dr. James Donahue, Professor of Medicine at the University of North Carolina School of Medicine. We all know that as COPD progresses over time, helping our patients manage their disease can become increasingly difficult. Like all LABAs approved for the treatment of COPD, Perforomist has a box warning. The results also showed that Perforomist works in as few as 5 minutes and lasts for up to 12 hours. 12-week trial with Perforomist, as indicated by maintained FEV1 AUC. Tolerance to the side effects of inhaled beta agonists can occur with regularly scheduled chronic use. Perforomist should be refrigerated, but may be stored at room temperature for up to 3 months. Mark is a 70-year-old man who was diagnosed with COPD 25 years ago and has been on maintenance therapy for 15 years. Mark's symptoms have worsened, and he now struggles to achieve forceful and rapid inspiratory flow. Questions you might ask Mark to determine whether he is experiencing insufficient inspiratory flow and is a good candidate for nebulization with a LABA include: do you use your rescue inhaler regularly? How often? Are you having difficulty breathing? Now here is Megan. She is a 55-year-old woman who was diagnosed with COPD 6 years ago. She currently uses a SABA but is not on maintenance therapy. For the past 4.5 years, Megan has used a nebulized SABA at home and a SABA inhaler when she is out. Recently, she has noticed an increase in her COPD symptoms.
For those of you who don't yet know me, I'm Dr. Rose DeLude. I've been a practicing audiologist for almost 20 years. I've worked for huge institutions, I've worked for small ones, I've worked for big ENT groups, I've worked with one-man ENT practices. What really has been motivating me over the past year is helping other people in our profession do what we do better. That's why I founded Audiology Integration Solutions, a company totally devoted to audiologists helping audiologists. Let's look at the general definition of these stages one at a time. We'll get down to the nitty-gritty for each one in later lessons. Attention is the first thing we must elicit in a patient with hearing loss. We have to get the patient to listen to us and pay attention. They are always asking themselves, why should I listen to this person? And we have to give them a good reason. Again, congratulations, and let's get started.